Hi, welcome to Professional Certifications channel. Let's break down NCLEX exam preparation, one topic a day for focused and effective learning. Today's topic is isolation precautions.
What are isolation precautions? Isolation precautions are measures used to prevent the spread of infectious diseases in healthcare settings. They are essential for protecting patients, healthcare workers, and visitors. Isolation precautions are categorized based on the mode of transmission of the infectious agent. Contact precautions, Droplet precautions, Airborne precautions. Each type has specific guidelines for PPE, patient placement, and environmental controls.
Step 1. Contact precautions. Contact precautions are used to prevent the spread of infections that can be transmitted through direct or indirect contact with the patient or their environment. Examples include MRSA, C. difficile, and RSV. Here's how to implement contact precautions. 1. PPE, wear gloves and a gown when entering the patient's room. 2. Hand hygiene, perform hand hygiene before and after patient contact. 3. Patient placement, place the patient in a private room or cohort with someone with the same infection. 4. Environmental cleaning, clean and disinfect the room and equipment regularly.
Step 2. Droplet precautions. Droplet precautions are used for infections spread through respiratory droplets, such as influenza, pertussis, and COVID-19. Here's how to implement droplet precautions. 1. PPE, wear a mask when within 6 feet of the patient. 2. Hand hygiene, perform hand hygiene before and after patient contact. 3. Patient placement, place the patient in a private room or cohort with someone with the same infection. 4. Respiratory hygiene, encourage the patient to cover their mouth and nose when coughing or sneezing.
Step 3. Airborne precautions. Airborne precautions are used for infections spread through tiny particles that remain in the air, such as tuberculosis, measles, and varicella, chickenpox. Here's how to implement airborne precautions. 1. PPE, wear a fit-tested N95 respirator or higher level protection. 2. Hand hygiene, perform hand hygiene before and after patient contact. 3. Patient placement, place the patient in a negative pressure room with the door closed. 4. Environmental controls, ensure proper ventilation and air filtration.
Step 4. Implementing isolation precautions. Implementing isolation precautions requires careful planning and coordination. Here's a step-by-step guide. 1. Assess the patient, determine the type of infection and the appropriate precautions. 2. Educate the patient and family, explain the precautions and the importance of adherence. 3. Use signage, place appropriate isolation signs on the patient's door. 4. Monitor compliance, ensure all staff and visitors follow the precautions. 5. Document, record the type of precautions and any changes in the patient's condition.
Step 5. Monitoring and reassessment. Isolation precautions are not a one-time action. It's essential to reassess regularly, continuously evaluate the patient's condition and the effectiveness of the precautions. Monitor for changes, watch for new symptoms or changes in the patient's infection status. Adjust the plan, modify precautions as needed based on the patient's condition and infection control guidelines.
Conclusion. To wrap up, isolation precautions are a vital part of infection control in healthcare settings. By understanding the different types of precautions and implementing them effectively, you can protect patients, healthcare workers, and visitors from infectious diseases.